More than 400,000 Singapore students aged 12 and above will be able to book appointments for COVID-19 vaccinations. That's from tomorrow. International schools aren't included in this vaccination exercise, except for a few of them. They are privately funded students from Anglo-Chinese School International, St. Joseph's Institution International High School and Chong International School. Tan Hui is live for us outside Singapore's Education Ministry for more on this. So, Hui, how safe is it for children to take these vaccines?
So according to studies, the vaccines are safe and effective for children as they are for adults. That's what the Director of Medical Services, Kenneth Mark, that's what he said during the press conference earlier. So these studies, they conduct a safety analysis. And during the safety analysis, they follow up on adolescents within a 2-month period. And it shows that children actually experience, it's very uncommon that they experience adverse side effects. In fact, they are very mild. But he did say that children have a stronger immune system than adults. So we could expect a higher incidence rate of minor effects like fever. But that is a common phenomenon across all vaccines. Now, the authorities are looking at and they are tracking similar practices across other countries. So let's take a listen.
This is the same position adopted by other countries, like the US. In fact, in the US, since approval had been granted by the FDA, there have been more than 6 million adolescents vaccinated between the ages of 12 and 18 years. So we'll be watching very closely the experience of others in the US, in Israel, and it will guide our policy even as we start our own program to offer vaccination to our school children.
There are also secondary benefits if children take the vaccination. Now, one of them is that it lowers the risk of other members in their household from getting the virus. Now, if you are a parent and you're looking and you're hoping to get your child vaccinated, here's what you can expect.
Those in the graduating cohorts at secondary schools and pre-university levels, as well as those with special needs, will be prioritized for vaccinations. They include students taking the GCE N, O and A level exams so that they can have greater flexibility in scheduling their vaccination appointments. Invitations will be progressively extended to other groups of full-time students aged 12 and above. Parents of those below the age of 18 should receive a link through SMS. They will then book their appointments through the National Appointment System. Parental or guardian consent is required for students below 18. Parents are also required to accompany students below 13, as well as those in SPED schools.
For students who require greater support and are unable to get vaccinated through their parents' booking, our schools will arrange for them to get vaccinated when school reopens.
Students below 18 will only be offered the Pfizer-BioNTech vaccine, as the Moderna vaccine is not yet approved for this age group. Studies for Pfizer-BioNTech were done with nearly 2,300 participants between 12 and 16 years old.
And there was a very high vaccine efficacy shown in the vaccinated group, with no COVID-19 infections being reported in this group, compared to 16 cases of infection in the unvaccinated control group. And this is a result that was consistent with the results reported in the adult vaccinated population.
Students can go to existing community vaccination centres to get their shots. The Education Ministry will also set up 4 dedicated centres. 3 of them will be at ITE college campuses and the other one at Raffles City Convention Centre. The vaccination exercise for students is expected to be completed by end August.